So we are so grateful to our three speakers, because I know you must be even busier than usual. But as I said, we do think that it's really important that both INGOs and government donors listen to the voices of Southern women's rights organisations in shaping COVID responses, which is why we're very grateful for you three to give up your time to talk to us today. First of all, we're going to hear from, and no, I'm really sorry because I didn't know I was going to be doing this. I haven't checked people's pronunciation, so I apologise if I get your names, your surnames wrong. I always know you by your first names. But first, we're going to hear from Noelene Nabulivou. I hope that's right. Noelene is the co-founder and outgoing political advisor of Diverse Voices and Action, which you probably know better as DIVA, for equality in Fiji. And she's a feminist grassroots organizer, policy analyst, activist, advocate, and movement builder for Fiji. And for over 35 years, she's worked to affirm and protect universal human rights and advance transformative approaches to gender, social, economic, ecological, and climate justice. She's also co-founder of DIVA. And we're very pleased to hear that Noelene has just recently been awarded the Joan B. Dunlop Award by the International Women's Health Coalition for her fierce activism. And Noelene's going to talk to us today, and it's highlighting the gender dimensions of the pandemic and why feminist response is essential. So Noelene, over to you.
Thanks very much, and it's a real pleasure. Can you hear me? Are we all right? Yes, great. Thank you. It's a real pleasure to be here. And I will just say, usually I would probably have a slide presentation or something, and because I think that visuals speak better than anything else, but we're a flat tech right now. We actually have a lot of both COVID-19 response work going on, but also we just had Tropical Cyclone Harold last week, and we're still very much in the aftermath of that. And a lot from our networks, from the women's networks, were affected. So yeah, we started in 2011, and I think what I'd like to very quickly do, because I know I only have 10 minutes, and maybe you can give me a wave at about 9 minutes or something, please. So I'll just back up and say that, I think it's really important whenever I do any of these to talk about my own framing. And so just to say that for someone like me, the personal is political, of course, and context matters, and that really we work in DIVA from a very strong kind of radical praxis approach. So one of the things that's been really useful for us, and I'd say that maybe first off, and we can talk about it later if we get time, is that we tend to exist primarily on trust-based funding, primarily from feminist funders. And we do that because it allows us kind of the opportunity to experiment and to organically grow and move into different areas. And then the other two things that I'd probably frame is that we work strongly from a inclusive and intersectional framing of feminism, and that we also have taken a lot of the kind of early work of South organizations like DAWN, Development Alternatives with Women for a New Era, who have a really strong interlinkage lens. So I'll talk a little bit later about how we use that in our work. So we're a lesbian, bisexual, trans masculine, trans men, and gender non-conforming group, but the networks have expanded exponentially across all sexual orientations, gender identities, expressions, sex characteristics since 2011. The second thing to say is that when you come from a small island state like Fiji, it's important to kind of talk about the context first. So there are other activists here who will speak from different, from different places. We're a Pacific small island state. I'm a lesbian, and there are many things about that that are both useful for the work, but also can confine our work as well. I would say that I'm working in a place in a region where we have amongst the highest per capita rates of violence against women and girls. 2 out of 3 women state that they've suffered from intimate partner violence. But also we've just done the very first baseline set of human rights research by DIVA for Equality. And what we know now after 4 years of participative work within communities is that the rates are even higher for lesbian, bisexual, and trans masculine women and people in Fiji. So the rates are around 84% have experienced sexual and gender-based violence. So we're also dealing with a climate crisis. This has its own kind of set of work that we have to do. So many severe cyclones, but we also have the floods that come whenever there are heavy rains. We have tsunamis, king tides, all of those things. And we're in our region, we have the last remaining colonial territories in the world, as many of you know, unceded territories, indigenous territories. There's a genocide happening in West Papua right now. So all of these things are also part of the realities. And we still have 6 countries and one territory that still criminalize homosexuality. So whatever we're doing in Fiji, even though we might have a Bill of Rights that's progressive, it really is about the enormous set of work on sexual rights as a whole in the region. And then there's the kind of existential loss that atoll states are facing, and sacred land and territories, and for many of them, they're facing the realities of possibly not being here in the next 30 to 50 years, and that's a horror that we don't want to think about. Then we have the geopolitics of being 22 island states and territories with Australia and New Zealand messing with us in the middle, and we've had 4 coups in 25 years, militarized, very small social space. It's very hierarchical and patriarchal. So there are things about that we have strong kinship networks, but also that means that we have indigenous kind of normed identities that are very masculine and male-centered. We're about to lose the sugar economy because of the ending of the Cotonou trade agreements, and a kind of new set of, and that very much is about your region as well, and about how we're going to deal with that. We have the last remaining tuna fisheries, healthy tuna fisheries in the world now, the only one left, and really I don't know if we can call it healthy anymore. And while we've lost 90% of the large ocean fish, OECDs tell us that they want to increase by 17% every year the amount of distance water fisheries, which goes to Europe and Britain and UK and US and the rest, for dinner tables over there. So we're dealing with a food security crisis in terms of our oceans here as well. And that's something that maybe we can do a lot more solidarity and co-responsibility work around. And then when you look at the globe, I'm not going to say too much, but to say, 200 species per day, we know we're losing, and we know that wealth inequalities that are all-time high. That's the same. We had a UNDP report that said that in the Pacific, our inequality figures are getting higher, and of course after COVID, that's going to be rocketing through the roof. But 1% of all, the richest 1% hold half of all the wealth in the world, and 50%. The poorest 50% own 1% of all wealth, and all of the other issues like military spending and the rest of it. So the reason why I first wanted to say that was when we're dealing with a COVID crisis like we are now, it's also about what is the state of the state, and I think it's very important for us to think that through, about not just how we're dealing geopolitically and economically within our own country and its borders, but also extraterritorially, what are the issues that are going on in the region, and then what are the issues that are going on in the world. We've got a lot of talk right now about feminist foreign policy, and even now, because of Jacinta Ardern and others, the discussion around feminist domestic policy. Okay, what does that really mean? What are we talking about when we're talking about progressive social, economic, and ecological justice concerns? And then when you add in a COVID-19 pandemic response, what happens? So one of the things that we very quickly started to think about is, so we've had 18 confirmed cases. And the good thing here is very quickly, because it's a small island state, we were able to close our borders, and there are particular areas of the country that were closed down at different points, and we haven't had a new, there's been over 300,000 people tested in our country, and we haven't screened, and we haven't had a new case confirmed over the last 9 days, which is a good thing. But one of the things that we continue to be completely aware about is that the minute that you shut down borders on a low to medium income country, then we have to think about issues of food security. We have to think about issues of those who are already in precarious work, which is basically everyone that Diva works with and has as our constituency, are already suffering both from food insecurity, from water insecurity, from a loss of jobs. We're in constant contact with our communities. We have 9 LBT hubs that are around the country, and we have also a network called Women Defend the Commons, which are women activists around the country who work on climate change and ecological justice. And so we have a telephone tree hub, and 2 to 3 times a week we're speaking to each other. And one of the first things that we already know is that people are not just extremely worried about the pandemic, but they're more worried about where the next meal will come from. And so one of the first things that we had to do, we've already had really 3 stages that we've been in as a local organization. And what we've been trying to do is to start with whatever we have. So what we had at the beginning is a lot of goodwill from feminists, local feminists, and we started this. So we did a very quick call and we got some money flowing, and we started the unconditional cash transfers and food security issues, food aid parcels. 1 minute to go, oh my goodness. So we did that, and then we branched out to a mutual aid strategy, and we're now working with rural and maritime women from Kandavu, which is actually the southernmost point, very rural, takes a whole night overnight. And the good thing about being from a group that already has strong networks is you can work very, very quickly. Even when there's lockdown, they can work with us, and we're just trying to work out how to keep communications happening, and two lots of food aid has already gone out to them. We're also working with rural farmers here who've lost a lot of their crop from flooding, and now we're concentrating on sex workers and LGBTQI people and widows and single-headed households. So we're kind of concentrating on those who we already know well. And so basically I just give a really quick rundown, and I can maybe make some notes and just pass them along, because I know we can't do much more now, we're already late. But understanding and investing in the care economy and redistributing work. I mean, one of the things we know from COVID-19 is it just completely breaks open the idea of capitalism and neoliberal capitalism, and allows us to say, you know, it's the care economy, and women are at the center of that, both the unpaid care that is going on, but also the paid care that's going on, the 70% of us who are in all kinds of care work. So we're working very much on making sure the government's listening there. We're on a working task group, and hopefully it's just gone to cabinet and been approved with a working document. So we're trying to get the policy pushed through, which is uncommon to have that quick a response from government for us here. Reclaiming the commons and public goods, maximizing public finance for social services and social platforms, and sustainable and ecologically sound infrastructure is what we're trying to work on. A really big part of is trying to recuperate the idea of loss and damage, insisting that when we're doing both climate change but also COVID response, that we're incorporating that into social, economic, and ecological policy. We're focusing also very much, because nobody wants to in the state, on bodily autonomy issues, on sexual and reproductive health and rights, because we're worried very much about access to abortions, access to contraception. A lot of women, as we know, are, you know, when we've got this high levels of violence against women, we've already been hearing from the Legal Aid Commission that they've been having 1,000 more inquiries in the first few weeks. So we already know that things are getting bad for women in the houses, and we're working out some specific strategies for that kind of situation. And there's a task force nationally that's working on that now. The biggest thing about that is trying to get us classified as essential services, because the state hasn't yet worked out that we're essential services. I don't understand how, but we're making that case in 100 different ways. Resisting kind of the insidious kind of capturing of public policy by neoliberal solutions, trying to kind of make the point to government that it's not going to be about public and private partnerships. That's not how we're going to get out of this. And we've got one of the biggest things is, what have we learned through this COVID-19 pandemic? And what we know is some really new sets of learning around who is it really, the real economy, who is it who keeps things chugging over. We've learned a hell of a lot about health systems, about emergency care, frontline action, and what we have to now put into place. And already already I can see some of the health ministers and foreign affairs ministers talking in ways that we've never seen before. So we hope that that continues. And I'll stop there. There's a lot more I could say, but I really thank you for the opportunity to kind of talk through some of the issues that we're dealing with right now. There'll be more. We'll put out blogs. Please go to our Facebook page. Thank you. That's it.
Noelene, thank you so much. That was really great. A real whistle-stop tour. And I think particularly sort of really interesting to hear about how a small island state is able actually to contain the virus really quickly, and it's the knock-on effects of the containment that are actually perhaps more threatening to the people that you're working with. And also really interesting to hear what you're talking about in terms of how do we, looking forward, use what people have learned from this crisis in terms of reshaping the care economy. Could you put in the chat box a link to your website or Facebook? And then there will be time for Q&A at the end where people can come back, but I'm sure people have got loads of questions. Thank you so much for that. I'm now going to move on to Leah, if that's okay. So I'm going to get the pronunciation wrong again. Leah Irenu is the Research Advocacy and Movement Building Manager at Akina Mamawa Africa in Uganda. And she's an African feminist whose current preoccupation is raising consciousness to shift power back to people to disrupt and dismantle institutionalized injustice. And we've asked her to speak about how feminists are organizing and responding to the pandemic across Africa, and what's the role of organizations like Akina Mama. So Leah, can I pass over to you? And I'll hold up a sign after 5 minutes and 1 minute, if that's okay.
Okay, but I'd put a stop clock too. Hi everybody, thank you so much for inviting me into this space. I always get re-energized in spaces with feminists, so it's a real honor for me. I wanted to just speak very quickly about organizing before and during the pandemic. So a lot of organizing for African feminists was happening offline and online before the pandemic, but a lot of it had also shifted online, mostly because of a shrinking civic space in a lot of African states. You know, you don't really have a lot of freedom to convene safely. For some LBT organizations, those were convenings that were broken up quite a number of times. Some of the issues that were discussed seemed to be quite controversial. It was really difficult to hold government's feet to the fire. So a lot of the organizing had moved online. And I'm excited because that structure had sort of been established, where there was a lot of sharing, a lot of meeting, a lot of convening and creating solidarity across borders using online instruments and that structure. Of course, that came with its own backlash. So there is a derogatory term these days that has been reclaimed called Twitter feminist. So when they say you're a Twitter feminist, was basically to kind of dismiss all the work that you are doing online and saying that you're all talk and you're not doing any action on the ground, which was not true. A lot of the activism and organizing that happened online actually translated to work on the ground as well. If you look at the mobilization around the Women's March in Uganda, which happened in 2018, much of was in response to femicide that was going on unchecked, and the government was really giving no response. You know, the mobilization happened online, and then it eventually spilled over offline. So I'm glad that that structure was already established, which prepared us for these times when in a country such as Uganda, there's been a total down, there has been a ban on public and private transportation, so people are not able to move anywhere. If you want to go someplace, you actually have to walk. And of course, there's been an immediate impact on women and girls and other gender identities. One of the things, just very quickly, I want to talk about the Ugandan context as well, is, you know, right now we don't have any deaths from COVID-19, but there have actually been other deaths as a result of the lockdown. You know, women dying due to childbirth-related complications, some women giving birth on the side of the road, some women, some parents actually losing their children. So those are some of the things that have happened. And of course, there's been an uptick in cases of gender-based violence because we have a curfew. In a militarized state such as Uganda, this was a perfect opportunity for a lot of the state authorities to actually exert a lot of violence on people. There was a really terrible incident a few weeks ago where women that were found to be breaking curfew were beaten up, made to roll in the mud, made to rub mud in their genitals, so basically to humiliate them, which was really horrible. So one of the things that feminists are doing is definitely pushing the messaging that this pandemic is disproportionately affecting women and girls and other gender identities. We might say that biologically men are more likely to die, but when we count the cost at the end of the pandemic, it's going to be women that will have borne the brunt of it. So some of the things that people are doing, number one, because of our collective anxiety and just misery, despondence, and all the mental toll that this pandemic has created, is to just create and continue a culture of care and create communities of care and support and affirmation. I can say that a number of organizations have actually come forward to provide psychosocial support to a number of activists, to just women that are looking to have an outlet. During this time where, you know, people are not interacting, people that had some mental health issues before, all of this has now been exacerbated. So an organization such as ours has actually reached out and tried to be a conduit to therapy sessions. But beyond that, I've actually seen some great work, people trying to organize meetings on Zoom to talk about self-care, to talk about mental health. I've seen organizing around a party that's happening on Friday that's organized by Agent Action Fund Africa, which looks really, really great. Just something to break the monotony and for people to connect and find that solidarity amidst this really dark time. They're actually calling it, saying it's a way of women daring to live in a period where we more or less have our death sentences signed. So I think that is just great, that organizing, knowing that we need that mental strength in order to survive this period. Another thing that I've seen being done very well is feminists marshalling their efforts and actually influencing the national responses to the pandemic. I've seen some fantastic work being done by FEMNET, which is also a network organization, bringing together women across the African continent. They're looking at a number of things, which is a feminist analysis of the responses that are actually taking place. They're looking at resource mobilization, ensuring that there is going to be relief for a number of communities that are actually very vulnerable during this time, which is mostly women. And they are doing fantastic work in terms of just communicating with people and providing important information, making sure that the response is actually intersectional and inclusive. They actually have this hashtag, dignified response. Maybe Mishy can even talk about it for a minute when she comes on, but I thought that was such a great response. But people have also been petitioning government left and right, making sure that their voices are heard and saying that their responses are actually not adequate, that women, and that their responses are gender blind, and that women and girls are not being factored into the design of the processes, and also apportioning of funds for the response. For example, for the lockdown in Uganda, there were actually no services for gender-based violence. And during the presidential address, the president actually joked that gender-based violence against women could not qualify as an emergency issue. So that just goes to show some of the challenges that are there. There's also been great resource mobilization by a number of grassroots organizations, because in a lot of the countries that I know, there are actually government task forces that are tasked with giving out food, providing relief, but they're not entirely sufficient and they don't reach all people. And they have defined for themselves who qualifies as vulnerable. And yet a number of people have lost their jobs, and even people in the formal sector have lost their jobs, and now they cannot pay rent, they actually cannot feed their families, and those people do not necessarily qualify for government support. So there's been a marshalling of resources, actually asking people, I've seen a number of fundraising efforts online, asking people to give a little so that then there is money that is collected, not just for relief food, but actually purchasing of protective equipment as well. In the absence of government support for services, for legal services, for gender-based violence, a number of feminist formations have actually come forward to make sure that those services are available, providing toll-free lines so that women are actually able to access those services, and also petitioning government to make sure that legal services, you would think it would be a given that legal services are actually essential services. When you get locked up during this period, it means you're locked up until the lockdown ends. There was actually a raid on an LGBTI shelter in Uganda about 2 weeks ago. And right now, those people are still in jail. They were charged with, I think, deliberately trying to spread a disease because, according to the police, they were in contravention of the directives from the government for social distancing because they were not related to each other. But these are people that are actually homeless because they've been thrown out by their families. And so they're seeking shelter from this place. So those people are actually still in jail. I had some good news yesterday that there'd been some progress made on the case, but that is just an example of people actually not being able to access legal services in a time that they really need it. Lastly, I would say, I am overwhelmed, but also so excited to see so much writing that is being done by feminists during this time. Of course, I've also seen some conversations around the fact that actually women are not able to produce as much work, as much academic work during this time because, as you mentioned at the beginning of the call, that there's so many other competing things. You know, you have childcare, you know, you have all this mental health issues, all these things basically colluding to make you not as productive as you are. But I've seen such fantastic resources, one of which is actually on the GADN network website, doing feminist analysis of the different responses, making policy proposals about what would qualify to actually help during this time. So really, really great work being done during this time. So yes, just one last minute, just to say, what can an organization like Akina Mama do, or what are organizations that are that have a degree of power, that have some that have constituencies? What are our responsibilities? I think now more than ever there is an obligation to hold space for our constituents, to understand that there is a huge challenge, but also to understand that within our organizations themselves, not everybody is okay. Just because you work in a feminist organization and you're out to save the world, we need to look at ourselves as well before we reach out to other people. I think formal organizations are able to coordinate efforts. There have now been a number of fund proposals that I have seen in response to COVID-19. That's where organizations such as ours step in, mobilize resources so that then our constituents are reached. And then above all, amplifying voices and making those things that are invisible, visible, bring to the front all those voices and all those issues that everybody is ignoring. Because everybody will say, but this is impacting all of us, everybody in the world, but it's actually not impacting us the same. And it's important to emphasize that. So those of us with loud platforms to just continue repeating that message over and over again until it's heard. All right, so I'll stop here for now. Thank you so much.
Leah, that was fantastic. Thank you so much. I mean, again, really interesting to hear how it's quite often lockdown rather than the disease itself that is causing the biggest problems. And you know, some of the things you were talking about around legal services being an essential service, I hadn't heard before. That's really interesting. And I think also your point about recognizing that that we know that it's mostly women who are doing the biggest juggling around unpaid care work, finding enough food for our families and so on and so forth. And that is going to affect how much we can put out as feminist activists. But as Sophie said, we are collating the resources that are being put out on the GADN website, and do anybody send us stuff that you think should be added on there. I'm going to keep us moving if that's okay for time, but Leah, thank you so much for that. I'm going to move now. In fact, Leah did a very nice introduction to FEMNET, and I'm going to move on to Mishy Singano, who's a program manager at FEMNET based in Kenya. She's a seasoned development expert and an African feminist with extensive experience in socioeconomic programming, in policy advocacy, and in development campaigns. And for more than 10 years, she's worked intensively on women's rights advocacy and campaigns from different angles, including violence against women, financial inclusion, women's empowerment, land rights, farmers and food rights, climate change, governance, and leadership and sexual and reproductive rights. And today, Mishy is going to speak for 10 minutes to us, sharing reflections on how the pandemic is playing out across the African continent, and discussing how to work flexibly with partners during the COVID pandemic. So Mishy, over to you. Thank you. Mishy, you're still on mute at the moment. Can you unmute yourself?
Oh,
thank you.
Morning.
Perfect.
Okay. Good morning, everybody. Been asked to put a video, but my network is a little bit shaky. So if you'll allow me, I would just like to turn off the video so that at least you can be able to hear me. But at least now you've seen my face. Okay, so I think first I just want to start with just giving reflections on. I've been asked to speak about how the pandemic is playing across the continent, and I feel it's just fitting also to start with how this pandemic is affecting individuals. And they have been, I think, across the board, an assumption that is this pandemic is affecting the other and not us. And as I'm speaking here, my cousin sister just got buried, I think 10, 15 minutes ago by the state in a very tragic incident, because as she was expected, I'm Tanzanian by the way, but I'm living in Kenya. So it's unfortunate that our government of Tanzania, the president decided to announce that COVID is not an issue. We cannot contain, or we cannot do lockdown. Everything should be going back to normal. So there is a state of lack of leadership, and everybody's trying to do what they can, but there is no comprehensive response plan. There is no lockdown. Like, everything is complete mess. And I think we are one of the country that we don't even release the data, I think, for the past 6-7 years for the past 6 or 7 days since the president made a statement. But because of that, when my cousin fell sick, the hospital could not admit her. So we moved from one hospital to the other. We went, my family went to almost 6 hospitals, and all of them refused her, and she ended up dying in the car, like in the stage to try next hospital if they will admit her. So, but after that, the state took her body, and I had to take it to Twitter to target the minister for us to be given a response from the state on, like, where is she? Will she get the body? What is the result? I just been informed this morning that it is actually the test confirmed it's COVID, and she got buried a few minutes ago. Now, this pandemic came or surfaced in a continent where there is weak institution, and we know that as a fact. There is a mature and delicate health system. We know we have uncouth political elite. We have fragile economy, which is been based on debt-ridden service industry, which only employ the elite few, but also it's based on, informal sector being the major employer. And we also it comes to the continent where patriarchy and inequalities are out of the day. So the pandemic itself, show up in a continent which has, for the lack of a better word, being an eco-fragile and in the state of emerging. But we do know as Africans in the continent and across the world that despite all that is not right in the continent, but there have been history of endurance and resilience among the people. As the daughter of the continent, we know across the history that we have gone through the worst crises, and we do believe that when well organized, we could be in a position to defeat and flatten the curve. And there is a gleam of hope. Some of the government are taking leadership. We've seen Senegal now has developed a $1 worth a test kit, and they are testing everyone. Literally, like their target is to test every Senegalese in the country, which is unprecedented. And it's way beyond what, for example, developing countries are doing. We have seen the likes of South Africa, Rwanda. They are literally like feeding everyone so that people can stay safe. So we know that with the right leadership, the states, African states, despite everything, they can be able to step up. We have seen institutions like African CDC, they have been organizing, supporting health ministries and health institutions across Africa, and they've taken a strong leadership to that end. We have seen women's rights organizations, as Leah have said, they're coming up, innovating to support the fellow communities. So we have, for example, in Kenya, organization just been approved to do a maternity license. So any, for example, pregnant woman who is in labor at the time of the curfew, they can just call that specific taxes so that they can be supported to access hospital. We have seen most of their partner, like now, are distributing family planning tablets, menstrual products, because with everybody locked down, we know there will be a lot of unexpected pregnancy, for example, etc. And individuals are innovating, young people, and all that. Specifically to organizations, specifically women's rights organizations, what we have come to learn, and as Leah said, like as an organization, FEMNET, we have stepped up, I think, earlier on to assess, organize, and to mobilize our members to respond. But some of the learning that we are getting and experience, one, we don't know a lot about emergencies and crises. I think for far too long, we have let this to quote-unquote humanitarian organizations, because we do, in our sense, crises, are sort of like war, earthquake, like those kind which are by and large led by UN agencies and quote-unquote humanitarian organizations. So we don't have ideas of what law are in place. We have never walked around them. We are not part, or we don't have a relationship with the response committee and response entities. So, in which our assessment, most of them are made up of men. So it's a struggle now then, when COVID demand all of us to respond, to start sort of like building relationship from scratch, starting like now looking for laws which govern response, etc. But also when the world is moving to virtual, the lack of stable access to internet in the continent is posing a huge challenge, not only to some of us who can afford and have that privilege to afford moving virtual to constituency that we are speaking to or we are representing. To most is not an option. So we can engage to our upline partners, but it's challenged to engage in your down partners. And it poses a question it's a power question at this point. Where is your allegiance be? You should continue just to work with your donor and the people who can afford, or you have to work with the people, with your constituency. We have, me personally being part of those lot of moving virtual days now, experience of virtual fatigue. So everything is being moved virtual, sort of like, like we're just moving from one to the other. We have seen most of the meeting have been scheduled at the wrong time with a little consideration of, who will attend from what point. We have to stay to midnight to be part of the meeting. There is a lot of analysis paralysis in most of those meetings. Like one of the things that the pandemic has really told us is everything moves so fast, but our way of analyzing and taking action has not been that fast. So we are getting to calls and calls just to discuss the same thing and doing analysis, which by the time like we have a new scientific data, that analysis might be redundant. And then there is a lecture problem on us being lectured on our problems. Yeah, we get to the call and you listen, somebody telling you how you are affected, and I know I am affected, but potentially I want to know how can do about it. And the legitimacy question is a big question to most women's rights organizations, particularly those who are doing advocacy work, because our constituency now have basic practical needs. Yeah, and it's not about speaking to them. They need to survive and live. And with everything going virtual, we don't have a significant experience of, for example, significant experience of influencing virtually. So our advocacy work has been shrinking. And then it's a struggle, like, do I go now to respond to practical needs? And I think one of the other things that we are witnessing is still funding to the response goes to the big and powerful. I'm really surprised that with everything that happened, we can still consider bureaucracy as essential service. It's surprising to say the least. And there have been a lot of talk around flexibility. Most of our upline donors telling us that you can be flexible in your program. But what does that mean in practical terms? Am I going to be held accountable to deliver the result that I promised in the framework that is submitted before COVID while I'm channeling some of the money to the COVID response? There is lack of clarity of the parameters of the flexibility. So the last part, just to summarize, what can GADN and the member do and support women's rights organization across the continent? I feel the first one, we need to save lives. It's necessary and it's needed, and there is question about that. How can we do that? I think we need to have a discussion on how we can play our role to save life. Is important. And then two is let's channel resources to the frontliners. It's not just a question of quality, but it's also a question of restoring and maintaining dignity. And we need to allow women's rights organizations to do right thing without worrying the constraints that have been pushed within the law frame, changes, contract amendment, and etc. Because this pandemic affects us as individuals first. So when I worry what I have to do, but I also have to go back to look at the contract and what's said, it's complicated. And let's allow to imagine the world to transform to an equal world. The world that we left before COVID is not the ideal world and should not go back to that world. How do we do the work that allows us to transform to a new equal world? And that will need a different thing. So should not be a question of putting pause on the program, but how do we reimagining a new work that get us there? We demand and we require solidarity from sisters, specifically from the West, when racism and anti-multilateralism is pitched as ingredient in the curve. We need voices from the global North to stand with us. It's tiring to, saving life, but also you have to stand up to speak about racism that comes or that isn't pitched as ingredient in the curve. And last, all of us, we have a duty to exercise the radical kindness, self, but people who we support. Thank you.
Mishy, thank you. Thank you so much for that. And I really find it incredibly moving that you still came on the call despite your sad news. And I'm sure that all of our thoughts are with your family in solidarity. I do hope being surrounded by so many feminists on this call can be some kind of comfort for you. But also just, again, the kind of lessons that you're talking about how it can be the process of lockdown that is as hard for people to cope with as the disease itself. And thank you so much for laying out some really clear points at the end of what we can all do. I think we have such a responsibility as feminists based in the global North to take that agenda for you. So thank you. We're going to move on to questions now. If you want to ask a question, can you click the raise hand option in the participants tab on your screen? If you go down to the bottom of your screen, you'll see a thing that says participants, and if you click on that, you can raise your hand. If you're having trouble with that, you can also ask a question in the chat box. We'll be monitoring that. If you are called upon to ask your question, remember to unmute yourself and put yourself on video if you'd like to. It is easier for everybody to understand your question if they can see you. Do please keep your questions short because we want to get as many questions in as we can. And then remember to put yourself back on mute and remove your raised hand once you've asked your question. I'm just, while everyone's getting their head around that, I'm just going to go to Fenella, who was supposed to be moderating but had problems with her computer. I'm going to go to you, Fenella, first to see if you want to start us off with the questions, and then I'll come to Sam, who's going to tell me who's in the participants box.
Thanks, Jess. And yes, somebody was talking about the difficulties of the virtual space as being the new organizing, and the stress of not being able to get into Zoom when you want to be in there really brings that home this morning. I'm really sorry, but I missed the presentation by Noelene, and I hope I'll be able to catch up with that later. But I had something just occurred to me just now that I wondered whether we could get some more discussion on, and that's this idea that Mishy was just talking about radical kindness, and how can we build, if we're coming from a position of real exhaustion and often personal devastation, as Mishy articulated so powerfully at the beginning of her presentation. And I wondered whether we could talk a bit about how we are able to get this idea of radical kindness into our COVID responses, into how we are asking both ourselves and our organizations to respond. So I guess it's a question for Mishy, but I think it could be a question for us all.
Okay, thanks a lot, Fenella. Sam, who have we got waiting for questions?
There's nobody currently with their hand up. If you would like to ask a question, if you could raise your hand in the participants box, or like Jess said, type it in the chat box. Geeta has a question. If you want to unmute and ask your question now.
Hi everyone. I'm Geeta, and I'm based in Nepal, and I work with VSO, and usually I was just reflecting that who are not based in the UK, but who have more of a global role within the organizations to be connected. So I think this is a good opportunity for us, and I hope that we can continue this kind of engagement even when you have the other regular meetings, that those of us who are not based there can join this meeting virtually. I want to thank all the presenters, and it was really interesting to hear all the different aspects in terms of some of the challenges and some of the issues and that is coming up, and that is also quite similar to some of what some of us are experiencing in other parts of in other countries. And in Nepal also, you know, a lot of those issues are quite similar in terms of the shrinking space, but also increased GBB violence, and also, you know, a lot of other, you know, in terms of mobility that is affecting especially migrant workers, you know, who have to walk and on the foot because all the public transportations are closed. And a lot of even though Nepal, we don't have any death due to COVID-19, and even the number of positive cases is quite low. It's so far confirmed is 52, but there are rumors that it's underreported. But still, you know, there are a lot of people who have, died because they've been walking back home and have not been able to reach home, and due to other complications, they've died on the way. There's also been increase of, you know, societal case and increase of, you know, rape cases being reported to the police. So these are some of the challenges I think that all of us are facing. I had a question for Noelene. You had shared briefly the new learnings in this COVID response, and I just wanted you, if you can elaborate a bit more on the new learnings.
Okay, thank you very much, Geeta. Sam, have we got anybody else?
Jess, this is Sophie. We've got a question from in the chat box. The question is from Howard Mollett from CAFOD. And the question that he'd like to ask is, to what extent the speakers have found UN agencies or donor government embassies, either foreign policy or aid policy leads, including the UK, receptive to dialogue with local women's rights activists or women working in humanitarian action in order to identify what their priorities for support in terms of political or funding support. So how receptive have they found donor governments and embassies in this time? Okay,
great, thank you. Let's take those three. Noelene, can I start with you? There's a question for you particularly around what are the new learnings as a result of COVID, but if you want to come in on either of the other questions as well, please do. Either the question about how do we put radical kindness into practice, or have UN agencies and donor embassies been receptive to speaking to your organisation and similar organisations?
Sure. I'll just quickly say the last one first, maybe, which is we really haven't had any embassies who've asked for, you know, kind of meetings or discussions with feminist or women's organizations. One of the things that I have to kind of say is in Fiji, the first thing that happened was most of the expatriate workers left. So that's from the UN, from the donor agencies, where I kind of say we're hyper-developmentalized here in Suva particularly. There's a whole kind of expatriate community, and basically they've all gone. And so that leaves a very different, there's several things about that. One is that there's a lot of homelessness in the Suva area, and yet there are a lot of these houses that are left with rentals paid for the next few months, and that, you know, for us who are working grassroots communities, there's a kind of development apartheid issue that we still haven't addressed there. So that's the first thing to say. The second thing to say is the opposite of that. The most positive response that we've had is from the New Zealand government. They offered unconditional cash budget for us. It's about 5,000 Fijian, nothing major, but what it allowed us to do is very quickly get some urgent SRHR and also food aid to women in one of the maritime remote areas, and they got the money to us in 4 days. And so for me, one of the things that answers the question about is whether, you know, can you do it in 4 days? Well, if a government can, then I certainly think that INGOs and others can. So that's a point that we've been making to a lot of people. if they can do that, then there are others who can do exactly the same. And then the next thing I would say, this issue around radical kindness for us is also about, it's about justice. We talk a lot about ecosystems of care in Diva for Equality, and the reason for that is we want to talk about structural issues, and that's those uncomfortable things, because a lot of the anger and pain that is here in South Feminist is often around things that nobody wants to speak about the things like expatriate culture, about the things like, who is there for us really when times are hard. And we talk about the difference between allies and accomplices. The accomplices are the ones who you can get on the phone to when you've been taken in by military or police. They're the ones who are there no matter what's happening. And some of the INGOs have had a difficulty in transitioning and pivoting to COVID work because of that. There's a heightened kind of punitive state in place right now, right? So it makes it difficult. Everybody's very cautious and careful. And I think that we have to think that through, because we have to decide together as a group, as a development community, as civil societies, how we speak both to each other, but how we also speak to the state and development agencies and the UN, who can speak and who can't. So I think that some of those trust-based relationships that we already have with each other are the most important. The ones of us who can talk to certain politicians, who can talk to certain, like the health minister or the prime minister's office and others, they do that. Others of us who can't because there is a political challenge, we have a conduit, that works this kind of above and below groundwork. And I think we have to rely on those long cultures of building up trust-based work. That's about radical kindness as well. It's about working out how you keep justice and real solidarity in place when it's the most difficult times of all of our lives, I think. And the last one, what was the last one? Was around, yes, the local, the learnings are that, but they're also around localized approaches to public education campaigns. We already know that from everything else we've done, right? But I think what COVID allows us to do is to say, very quickly, we can have an analytical kind of set of work around why are people breaking curfew? So for instance here, because there's a high level of kind of masculine behavior that's expected, like the big man culture, and people are expected to go to community gatherings, and they break curfew because of the family expectations and the expectations of prayer meetings and all kinds of things. So what we've been trying to do is to put together different kinds of campaigns, whether they're on radio, whether they're telephonetry, whether talking through these issues and saying, okay, if this is happening, how do we do that? How do we change the behavior? We've had special advertisements that are targeted at men themselves and working out what they're doing and why is that behavior happening. We've gone really quickly front and center, like a saturation campaign from all of us on sexual and gender-based violence. We thought if we don't get that in really, really quickly into the national conversation, it's not going to be taken seriously as a central issue. So we've tried to kind of make sure that we're working both public campaigns, but also in the working group with governments, and also on radio and ad campaigns. There's various others, but I think those are some of them. Just this ability to kind of work in many different ways to hit many parts of the community. And the most important is that constituency politics is at the heart of all good organizing work, and that in the end, when you have nothing, when it's really tough to move, it's our relationships that we've got to know each other. People will move mountains to help each other if we've known each other for 5, 10, 15 years, 20 years of work.
That's great, thank you. And I wonder whether we might do a bit of work around looking at the New Zealand's response and seeing whether that's something that we can put forward to try to persuade other governments to do the same, if it seems to be a better response than others. Leah, do you want to come in on any of the questions and maybe saying a bit more about radical kindness and what that might mean in practice?
Yeah, I was actually about to talk about Jacinda Ardern because she encapsulates, she exemplifies for me that very empathetic and decisive leadership. And I think we've seen that the results speak for themselves. And contrast that against the big man, strong man kind of leadership exemplified by Trump or Jair Bolsonaro, or now Magufuli in Tanzania, who's basically saying that coronavirus is the devil and let's just pray it away, which is really, really irresponsible. So I think there is a leaf to actually pick, to not frame this in a language of war, which is what a lot of leaders are saying, that this is a war and we must defeat it. That may be true, but we cannot use warlike tactics for this kind of enemy. If you look at a case of Uganda where workers were basically told if they wanted to keep working, then their employers are supposed to find for them accommodation at the workplace. And for women who work in open air markets, they were told that they could not. So we had a presidential address at about, let's say 9 p.m. And that's when a curfew was imposed. It took immediate effect. And they told everybody, you cannot move from wherever you are. So the women that were in the markets at the time were told that they could not return to their families and that they needed to sleep at the market stall. And then a few days later, a picture, of a woman asleep at her market stall, was circulated in the press. And the president was so excited about it, said, yes, that's exactly what I'm talking about. I can see that Ugandans are very serious and that you're taking our directive seriously. And there was no empathy directed at that woman because the president did say that this is not a time of convenience, which is true. But it doesn't mean that people should then be abused. It doesn't mean that we should then accept and lionize suffering, which is really what was being done. So I think there is a leaf to pick from Jacinda Ardern, but then to also look at us, because that radical kindness applies to us as well, but to also acknowledge that our wells are dry. There is only so much giving that you can give. So there has to be some replenishing. And how does that replenishing happen? That is where our communities of care and our communities of support come in. That is where that psychosocial support comes. If we are unable to, constantly go somewhere and scream and talk to somebody, there will be no kindness to give. And that is when we'll, start adopting the warlike language and saying that this needs to be done, and we don't care if other people get killed as this is happening, as long as we get rid of the virus eventually. So I really just to understand that kind of support that is required. It is not something that a lot of donors understand, unfortunately. If you tell them, because right now, the good thing, at least that I've seen from our roster of is everybody saying, can you reappropriate the monies that you have now to respond to COVID-19? And obviously a lot of them are liking to see, some kind of relief, which is absolutely fantastic. But that mental health is critical, and it's not something that you can touch. And so it's just really difficult to justify. So people are just thinking, people need to eat, but people need to live. Sometimes you are so depressed that you cannot eat, like you cannot be there for your family. And that is the kind of support that I feel that feminist organizations and formations actually need to make sure is part of the response. Yeah.
Fantastic, thank you very much. And Mishy, can we come to you on the same three questions? In particular, you were asked the question about what does radical kindness mean in practice, but also the question about whether you've engaged with UN agencies or donor embassies and whether they've been receptive to speaking to FEMNET. If you come off mute, Mishy, and then we can hear your answers.
Yes, so I think I'll start with the last one on the whether donors have come speak and engage us. The response will be not quite. What we have seen is mostly our traditional partner who come to us in to adjust our programming, not necessarily on we are responding now, what's at the needs, what's at the priority. So it's sort of like energy draining that at this time of crisis, we also have to still fight our way in the discussion and decisions of the response. And we think that is unnecessary, and it's just, it's a necessary use of our energy and effort. We do know there is conversations around All Africa program, which will be supported by most of the development partners, countries, and so they are working. It seems like they are going to support mostly African Union, ACC, and other UN entities, but it doesn't come to women's rights organizations. We are not even invited in the table to shape. We have to hear this information when we are trying to sort of like to get clue of what is happening. So we have to do extra work to call people, to lobby, to get this information because it's still confined. We did had a conversation with UN Women to ask if they can ensure that women's rights organizations are part and parcel of the processes. So for example, we know UN Women in the continent are leading in developing analysis of gendered impact, but we did ask them whether they are making a necessary action to ensure women's rights in specific countries are consulted, because this is not the time that UN has to release a report and then we have to do a counter report. We don't have that time nor resources to develop shadow report for the UN report. Can we do one? Can we share our realities? So we are trying to do a lot of work around lobbying on how women's rights organizations and women and civil society in general to be part of the response plans, to be part of this discussion and not us to be outside. So yeah, and in terms of, and also I just want to echo what Noelene has said. All our expatriates in the continent has left. There was sort of a rush, and it was I don't have a better word, but like there was a time when like literally embassies are telling their people like, catch the next flight, like go home, and it's like it felt so lonely to say the least. And that sense of nationalism, like ours against yours, we are taking our people away, we are leaving you, like it's the spirit when the crisis hit, you want that solidarity and you've not seen it. It's like we have a better system than yours, so we'll take our people home and then we'll support you from far. And it speaks a lot in terms of the value, the relationship that we had. And I think with all fairness, if COVID did one thing right, is exposing all the evils of the society, but also exposing the best about the society. So it was such a reality check. It helped us to understand the best within us and the worst among us as well. So everything now is in display, and it's for us now to say, now we know how society is made of, what do we do about it? How do we enhance, embrace, and invest on the good? And how do we address the evil within our societies? And with regard to kindness, I think two colleagues have spoken well about it. I do feel personally that when we hit our lowest point, we need something, yeah, and that understanding that what I need is the same person will need the same thing. Like, so how can I give to the person who need what I will need to be given to me? Yeah, so just putting in people's shoes. And at this point, as much as I agree with the idea of, like replenishing our energies and our kindness, but it has to reach to a point, I feel that we need to get satisfaction in giving, so that we'll, I don't know how best to say this, like by you giving, you get something rather than waiting for you to get something to give. Yeah, how can we find satisfaction by helping others? How can we, when we hit the tragedy, can that tragedy trigger you to say, if I have experienced the worst, can I, use my experience to prevent the next person from being in the position that I have been? Because I might not have or that next person might not have the privilege to, you know, to deal the privilege that you had. So how do you extend and, you know, give as you receive? Thank you.
Note to finish on. And I think, as you say, what we're seeing is COVID exposing the best and the worst of society. And I think one of the really underlying points coming through so strongly is that we have to make sure that society is a better place afterwards. We have to use this as an opportunity as well to start reshaping the way we look at society. And I think that's coming through all of your presentations. We're running a bit late, so I'm going to stop us there. I know we've got one question waiting about what concrete things can we do. One of the things that we at GAD will do is try to pull together some of the things that have come out of this discussion into concrete recommendations and go back to our speakers to check in with them that's what they mean. We're constantly hoping to work with Southern women's rights organisations to pull out concrete recommendations that we can then amplify. And as one of you said, it's so important that our role is to amplify voices of the people on the front line. I want to extend such a massive thank you to our speakers, particularly Mishy on this really difficult day, but to all three of you. I know how busy you are, and it's so important for us to hear from you. And we will keep talking to you if that's okay, and keep ensuring that others can hear from you. We're going to move now into breakout groups, and I think you three are welcome to stay, but I understand you've probably got other things you need to do. But really, you know, I know if everybody wasn't on mute, they would be extending their thanks.